Ironically, today being February the 7th, I believe, copy of a letter, February 7th, 2013, where City Council sent a letter to Governor McDonald encouraging him and the administration to find a way to help people in our region. At this time, it was 3,000 people, okay, affected by Medicaid in our city, in our city alone. That number may have increased over the last 12 months. So I am certainly hoping that the governor, the General Assembly, can find ways to provide health care for people who need it. That everyone, the 140 people in the General Assembly, the 535 people in Congress, would put politics aside and put people and health care first.
We are stuck because we don't have access to health care for people like Ms. Kathy. Some would say that fraud has created a lot of the issue here and that healthcare costs are so high because of that. But the study that was done by DMAS, by the people who are neutral, found that only 0.3%, so 0.3% of Medicare healthcare services is fraud. That's not where this money is going. This money is going to the majority of hardworking people, the people who have worked all their lives, who've contributed to this community, who contributed to the Commonwealth of Virginia. And it is our duty to take care of this community. It is our duty together to be that safety net for Danville and Pennsylvania County. We are a partner with PATHS, and we have been for many years. We provide labs, imaging, and various studies for patients who come to this clinic. We have our own family medicine residency clinic that takes care of patients just like Ms. Kathy here, who otherwise wouldn't have access to care because they don't have health insurance. But what we see is there's still many other people just like Ms. Kathy who can't get in for an appointment, who can't pay even $30 for a copay. We have our free clinic, which is a partner for us. It still takes money to take care of these patients. Now, what Medicaid expansion does is it takes the $318 million that we pay in taxes for these services and has the potential to bring back $349 million. So Southside Virginia, because we're the rural area, because of our need for health care and the state of health in this area, we have the opportunity to bring more money back if we sign on to
There's a number of issues. I just want to build on what everybody has said. Jobs, 32,000 statewide, at least 8,000 to 9,000 in this area alone. We train nurses here. Averett's doing a great job. DCC's doing a great job. We train technicians. All these medical people are in the pipeline. But when they get through, they're not going to have a job in this area. So what are our youth going to do when they get? They're going to go elsewhere. So our youth drain will continue. We need those jobs here. Secondly, UVA and MCV are taking cuts from the General Assembly and through Medicare. They will be able to treat less people. To make up for that, we need this Medicaid expansion so we can treat cases here. Now, UVA and MCV, where I went, are great places for tertiary or very specialized care, such as liver transplants and things like this. But a lot of the things we have to send to them, we could be doing right here in this hospital. If we had Medicaid expansion, we could take care of probably 70–80% of what we send to MCV or UVA right here in this area locally. More jobs for our people. Jobs again. Lee County Hospital in far southwest Virginia, where I grew up, is closing. Part of this is because they're losing so much money. They have a huge population of non-paying and low-income people. They can't afford to stay open, so they're closing hospitals. We're going to have to. It's going to cost our hospital jobs if we don't get this Medicaid expansion.
I think that's our challenges today, is how we can bring this together with our legislators. And I don't want to quote everybody, but Dr. Miller mentioned jobs. Sherman and I both worked a good year. I worked a good year. I was salaried. And one day I got a letter that says you no longer have benefits. But I was one of the blessed ones that was fortunate enough that I could afford my insurance. I could have been one like Dr. Miller. I could have had to sell my home, my cars, everything I had worked to for 30 years. And there's a lot of people that is worked there that's doing that as we speak. This is not new to somebody that's worked on the farm and never had anything. This is across the board. This is serious. So I just, hope we can all together, as a community and business people, to get these messages like Miss Kathy, to our General Assembly and to our Senate.
Delegate Daniel Marshall at 804-698-1014. Les Adams at 804-698-1016. And Senator Bill Stanley at 804-698-7520. And I encourage everyone to call them and ask them to support this. Write letters to the editor. Get your friends to call them, email them, stay on their case, and let them know that we elected them to do just this, take care of the citizens of Virginia.